everyone. Good evening. I'm Sayukta, your host for today's live from All About Skin Wellbeing team. And I'm sure all of you will be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch a lot. It itch intensely, and it may be due to the chemicals in certain food items, allergy to certain medications, insect stings, sunlights, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it. And doing self medication can actually worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us renowned dermatologist Dr. Amlan Jyoti Sarma, who is an MBBS, MD, dermatologist, venereologist, and joining live from Sri Rajalakshmi Durg Beltola Tenali, Guwahati. A very warm welcome to you, Dr. Amlan Jyoti Sharma.
Thank you, Sangyuka, for your kind introduction and welcome viewers to our live session. Good evening, everyone.
It's a pleasure, Dr. Amlan, to have you with us. And today, we are going to discuss about a very important topic, which is the management of urticaria. And Doctor, let's start the whole discussion. First of all, we would like to understand what is urticaria.
Okay, so according to the Rook's textbook of dermatology, which is the standard textbook, the urticaria is being increasingly used to describe a disease that may present with short-lived itchy wheals, angioedema, or both. So it appears as a raised, well-circumscribed areas of redness and edema, which is swelling, involving the dermis, that is the deeper layer of the skin, and the epidermis, which is the superficial layer of the skin, that are very pruritic. So this is how it presents, and it is usually a very uh, difficult condition to manage at times, and patients also, they are very much concerned and visit us with this condition.
Okay. Now, doctor, whatever allergy or infection we have on our skin is generally like looks like a rash, for a layman,
Yeah,
for
yeah,
us to understand that how does it
okay,
looks like. So it looks
okay,
like a rash normally, any
yes,
infection or
yes,
allergy, it will itch a
okay,
lot. These are some
yeah,
very common,
yes, yes,
characteristics
yes,
or we
yes,
could say the patterns.
yes,
I would like you to explain a little more for us, all of
yes,
us, to
yes,
understand how does it look like, so we can differentiate that. Okay, so this is urticaria, and we need to go and consult a doctor.
okay, definitely. So, as I said, urticaria, in the common language, it is known as the hives. So, it presents with the wheals. Now, what are wheals? So, the wheel is a descriptive term that refers to a transient, well demarcated, superficial pink or pale swellings. These will be very much well defined. The color will be like pinkish or reddish, and a bit of edema, that is a swollen red lesion over the skin associated with itching, and these are transient. Now, I mentioned edema, that is swelling. Now, this is because of the exudation of the plasma into the dermis, that is in the deeper layer of the skin. So, for a layman, whenever they see any raised erythema, that is raised red lesion with a little bit of swelling and itching, so that is how we can differentiate it from the other kinds of rashes, that it is an urticarial rash.
Right. And doctor, what are the common causes responsible for urticaria?
Okay. So, for urticaria, there are many possible precipitants. These may be some recent illness, like any upper respiratory tract illness or some streptococcal infection. Then some medication use, like for example, non-steroidal anti-inflammatory drugs, or for example, opioids can also lead to urticarial lesions. Then, if some radio contrast media is used for the purpose of radiological tests, then some foods can cause urticaria, some perfumes, hair dyes, detergents, then exposure to the pet dander, dust, mold, chemicals. Even in pregnancy, patient can present with urticaria, as well as contact with nickel, rubber, latex chemicals, industrial chemicals, and also sun exposure, exercise, alcohol ingestion even sometimes can lead to articarial lesions.
Right. So n number of things can
Yeah,
be responsible. Okay, the
yes,
list is like it's never ending, a
the
long, long list. So we can
long
say, doctor, it's a skin allergy.
yes, yes, definitely. It's a skin allergy, and the causes of which are manifold, as I mentioned, few of them. And most commonly, acute urticaria that presents because of some recent illness.
Mhm. So mostly the chronic is the one where the reason or the causes
Yes,
could be unknown, right?
yes, 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 yes,
Now, as I've already mentioned in the introduction
yes,
part, that it
yes,
is broadly classified in acute and chronic.
yes, yes,
How do you
yes.
differentiate it?
Yes. So the urticarias can be differentiated as acute or chronic based on the duration of symptoms. If the duration of symptoms is less than 6 weeks, then it is referred to as acute urticaria. And if the duration of symptoms lasts for more than 6 weeks, then it is referred to as a chronic urticaria.
Okay, so it's based on the duration, right?
Duration. Yes.
Hmm.
Yes.
Is it comparatively easy to treat acute one than the chronic one?
Yes, because as I said, in the acute urticaria, mostly the reason is some kind of infection that might precipitate the lesions. So
Mhm.
once we treat the infection, or for that matter, other underlying cause, then it leads to the resolution of the rash. Whereas in chronic urticaria, as you also mentioned, that sometimes the causes may be unknown. In that case, it is very difficult to manage such cases, and they might need to be put on antihistaminics for a long time in order to control the rash.
Right. Now, as you very rightly said, doctor, that it is a skin allergy. Now,
Yes.
what we normally do, the tendency of the people in our society is to go to the
Yes.
chemist shop, buy an
Yes,
over-the-counter medication or anti-allergen.
yes,
And we are so informed these days. We
yes,
know many anti-allergens by heart, their names, etc.
yes,
Just go and get one and pop it and
mm,
done. As
yes,
soon
yes,
as we see the relief, we feel that
yes,
okay, it's fine.
yes,
Is it an okay to do practice, doctor, to get over the counter medication or anti-allergen and to treat ourselves, or why is it important to go and consult a doctor?
yes. Most of the times we see that patients they go to the pharmacy, get some kind of a anti-allergic medication, then take it, then they get transient relief. So here, this point is very important. Once they take the antihistamines, definitely they will get relief, but that will be very much transient in nature. Again, once the effect of the antihistamines wean off, the patient will represent again to us with the similar kind of lesions. Now, that is because the underlying cause is not being treated properly. Because the chemist shop or the pharmacy will just give you one or two medicines at most, which they will take for 2 days and get relief for another 2 days. But again, more or less, the patient will present with the same lesion. So, it is very much essential for the patients to visit the dermatologist so that the underlying cause can be exactly found out, and accordingly the treatment can be continued so that the patient can get relief for a longer time.
Right. So it's important to get the diagnosis done. It's important to understand what is causing urticaria and to rule it out, or to
Yes,
because those can actually, the reasons is the one that triggers it, right?
yes,
So we
yes,
can
yes,
get
yes,
relief from that point of view as
yes,
well.
yes.
Doctor, how serious could urticaria be?
Yes, urticaria can be actually very much serious. It can be
Mhm.
associated with angioedema. Now, what are angioedema? It is the deeper swelling of the skin or the subcutaneous tissue. Now,
Mhm.
angioedema, as opposed to urticaria, is a little bit different. It is not very much well defined. Urticaria, on the other hand, it is very much well defined. You can directly see and tell that, yes, I am having some kind of a lesion, but angioedema sometimes cannot be very much well demarcated from the normal skin. The color of the overlying skin remains normal and it is painful rather than itchy. Now, the catch is if angioedema occurs in the vital structures, like, for example, the larynx, which is in our respiratory tract. So that can lead to the airway obstruction, and the patient can land up in the hospital emergency with severe breathing difficulty. Also, sometimes there can be the anaphylactic shock associated with the urticaria. Now, this is a
Mhm.
severe life threatening condition associated with systemic symptoms. The pressure might fall, the blood pressure might fall, patient will have difficulty breathing, and the vital systems tend to shut down unless he is resuscitated at the earliest. So these are the certain conditions where the patient can have serious consequences if the urticaria is not treated or detected at an early stage. Sometimes this can be the consequences associated with the urticaria.
Right. And this makes it even more important to go and consult a doctor rather than doing self medication or
Yes,
buying over the counter
yes,
medicines.
yes,
Now,
definitely.
doctor,
Yes,
how do you treat
yes,
urticaria? When a person comes to you with urticarial rashes,
yes,
what is
yes.
the first thing that you do? Are there tests that you get done, or just by the clinical investigation, you can say that, yes, this is urticaria, or what do you do normally?
Yeah. See, generally in the acute urticaria, which is urticaria lasting for less than 6 weeks, the laboratory studies are not indicated. So we can see and tell, yes, patient is having urticaria. We take the history. If he had any prior illness, that is cough, cold, or maybe fever, if he had any history of ingestion of any drugs, which I mentioned can lead to urticaria, or any other of the triggers of acute urticaria. So accordingly, we can manage by directly starting treatment for the underlying cause as well as for the urticaria. But laboratory studies, yes, they are definitely indicated in case of chronic or recurrent urticaria, that is, which lasts for more than 6 weeks. Then we need to go for a complete blood count, ESR, thyroid stimulating hormone, and also in sometimes some cases anti-nuclear antibodies as well. And other studies which may be considered include the imaging studies. Now, these are generally not indicated unless suggested by specific symptom or sign, which I mentioned if patient has systemic symptoms, for example, in the severe forms associated with angioedema or anaphylaxis for that matter. And also if we suspect something known as an arterial vasculitis, we may need to go for a punch biopsy. Other than that, mostly the diagnosis is clinical. And as far as management is concerned, so if, as I said, the patient is having signs and symptoms of life-threatening angioedema or anaphylactic shock, then we may need to go for some pre-hospital measures, which is if associated angioedema is present, we might need to go for a intramuscular epinephrine, which is a life-saving drug. If associated bronchospasm is present, we might need to go for the nebulized salbutamol, which is a bronchodilator that helps in the breathing once the bronchospasm is there. And other measures may be appropriate, like some ECG monitoring. These are in case of severe cases. And generally, for the arterial part, the first line management includes a second generation H1 antihistaminic. H1 and H2, these are two histamine receptors. So we need to block the H1 as the first line. And for that, we go for the second generation H1 antihistamines, which includes cetirizine, levocetirizine, loratadine. These are the
Right.
first line drugs which are started for the management of urticaria.
Fair enough. And doctor, we can imagine the person who have, urticaria, because a lot of itching is associated, right?
Yes, yes,
This
definitely.
definitely hampers the quality of life. Many times, people with urticarial rashes start hesitating in going out or socializing, or their public or, their social life is hampered, which is not a good thing because,
Yes, yes,
again, there will be a lot of stress, etc.
yes,
Now the thing is that as soon as they go and visit a doctor, get the treatment started,
yes.
how soon do they get some relief at least?
Yeah. So once we start the patient on the second generation antihistamines that block the H1 receptor, generally we see that there is a very good response to the antihistaminic drugs. Patient get
Mhm.
relief as soon as within a 24 to 48 hours, they will say that they have stopped having newer lesions. But the catch is they need to continue treatment for a considerable duration of time before it can be stopped. And if we see that is not responding to the starting dose of the antihistamines, then we can tighten up the dose, up dose the antihistamines. And if again, even after that patient is not responding, we can add another H2 antihistaminic like a cimetidine, famotidine, and ranitidine. So patient can expect to get relief within 48 hours after starting treatment, because these antihistamines are uh, very much faster acting and they give very good results, and which we see commonly in our practice. So it's very important to start the treatment as soon as possible.
Exactly. And, there are so many people who are suffering from urticaria, but then they are suffering in silence. They are not talking about it. They are not coming up and, consulting a right person, which is a qualified
Yes,
dermatologist, because they
yes,
hesitate, many a
yes,
times, and they feel that there is no relief or there is no treatment. But as
yes,
you said, treatment is there. You'll get relief very early. You just need to
yes,
go to the doctor at the
yes,
first stage.
yes,
So if you
yes,
have urticaria, if you have urticarial rashes, please go and consult a qualified dermatologist. That's really important. And
yes,
I would also like to ask Doctor, I'm sure you must have also heard about patients, especially of chronic urticaria,
yes,
asking that will it go away permanently? Because there, the treatment is little
yes,
longer, takes
yes, yes, longer,
longer,
yeah,
and they need to have the medications for a longer time, and
yes,
their only question is how will they go away
go
permanently?
away,
What's your
yeah,
usual answer
yes.
to it?
Yes, yes. So, when I usually encounter such patients who are having urticaria for a very long time, chronically relapsing and recurring urticaria, so I advise them first and foremost to never stop the drugs which I have prescribed without consulting me. So, initially, in such cases, I start with the H1 antihistaminic as well as the H2 antihistaminic. Then I continue them for around 2 months, sometimes in fewer cases, maybe up to 3 months. Then gradually we have to taper. We have to advise that we will definitely wean you off the drugs, but one by one and in a phased manner. And if the patient follows that advice, then definitely there is a very much good chance that he will be in remission for a longer time. And of course, there is nothing like that. It cannot be cured. Only thing is patient has to be advised and reassured that there is absolutely no harm in taking this for a longer duration, because as I said, the second generation antihistamines are very much safe. Only thing is the patient need to continue the drugs for a longer time, and definitely we have to stop the drugs, but that will be done over a phased manner in a staged fashion. After one, after another, will stop, and over a period of maybe around 6 months, also in some cases, they need to take the tablets continuously in order to get chronic relief.
Okay. Now,
Yeah,
again, one more tendency that we have normally in our
yeah,
society is that, for example, I'm a patient of chronic urticaria and I'm getting
yeah,
treated by you and I have a prescription with me. Now, as soon
yeah,
as I'll stop, seeing the,
yeah,
the reoccurrence of urticaria or something, I'll say that, okay, I've got relief. I'll stop
yes,
the medication all by myself without even
yeah,
discussing with you.
yeah,
Then again, when
yeah,
I'll start having urticaria, because I have the prescription, I'll go
yeah,
back, get the
yeah,
medicines,
yeah,
and start it all
yeah,
over again.
yeah,
I'm sure you
yeah.
must have seen patients doing the
Yes,
same.
yes, yeah.
What's your, say on this? Is it again okay to do practice, or we need to trust and follow our doctor and keep the doctor in, loop?
Yeah, yeah. So definitely it's not okay to follow this, because again, once the patient abruptly stops everything, then definitely he's going to have newer lesions. So as I said, we have to stop it in a phased manner. And in certain cases, if the patient is still having lesions, even after continuing both of these antihistamines, then in those cases, we might have to consider the other options, like some other immunosuppressive drugs, like a methotrexate maybe, or maybe we can also go for some glucocorticoids to tread over the acute phase. And in some cases, the biologics like omalizumab can be preferred. But these are for very special and reserved classes of patients. Generally, patient gets relief on starting the antihistamines. Only thing is we need to advise them not to stop them on their own. And definitely, if patient follows this, and if they stop it in a phased manner as advised by their dermatologist, then they will have a remission for sure.
Okay, doctor. And
Yeah.
doctor, what are the potential complications of urticaria if left untreated?
Yeah. So potential complications, as I said, if urticaria is left untreated, one is it very adversely affects the quality of the life. As I said, the patient will have difficulty going out and in his social interaction, because he is having chronically itchy lesions, and which is very much cumbersome for the patient to carry out his day-to-day activities. And as I said, some potentially life-threatening conditions can also be, seen. As I said, like the angioedema of the lips, tongue, or larynx. And in some cases, if the arterial lesions they are longer lasting and painful, then there is something known as an arterial vasculitis, which again is associated with some systemic disease. So that can again warrant further systemic evaluation and treatment. So if left untreated, sometimes you can have this angioedema, or even some in some cases anaphylaxis, as I said. So we need to treat it at the earliest before any severe signs and symptoms develop.
Right. Now, doctor, we can imagine, the plaque that the patient goes through because a lot of itching, etc., is associated. So, anyways, the
Yeah.
person or the patient is under so much of
Yes.
stress. Plus,
Yes.
can stress cause urticaria or can stress aggravate urticaria?
Yes, yes, stress can also aggravate urticaria. So urticaria, it is basically because of the histamine release as a result of the mast cell degranulation. And definitely, yes, stress is another factor which needs to be addressed while managing a case of urticaria, because it becomes a kind of a vicious cycle. Patient having
Right.
lesions, then these lesions will lead to stress, stress leading to newer lesions, and in that particular cycle, he will stop having his medicines. He or she will stop the drugs, and this will further aggravate the entire scenario. So, yes, definitely, it is another very important aspect that needs to be addressed while managing a case of urticaria.
Right. And the only way
Mm.
to break the vicious cycle is by
Yeah,
going and consulting a
yeah,
qualified doctor.
yes,
Right.
yes,
Many times, patients with urticaria will complain that their hive or urticaria get worse during night.
yes, yes. Okay.
Right.
Yeah.
So,
Yes.
is there a correlation, or what could be the reason behind it, doctor?
Um, Sometimes you see the patients, they do complain. Yes, at night they have these newer lesions. So in that case, we need to take proper history if patient is taking the drugs properly or not. The nighttime dose of the antihistamine which was prescribed, he might have mistakenly taken it in the morning or might have missed the dose. So these are certain conditions or causes which need to be ruled out if the patient is adhering to the treatment guidelines as prescribed or not. Even after that, he is having these lesions, then we have to look for some other causes. Like for example, at night time, sometimes if he is having, if he or she lives in a cold weather, then these are also some conditions like cold induced urticaria can be there, the environmental factors, the physical urticarias which are there, these need to be ruled out in such cases. So yes, it is a commonly seen that some patients do complain at night, and in those cases we can updose the dose of the antihistamine. Suppose he's taking regularly, but even after that, then at night
Hmm.
whichever antihistaminic we are giving, we'll say that you increase the dose, then we'll see how it responds or not. So that is how I go about it usually.
Right. And many a times, patient will also complain of being very tired or fatigued.
Yes, yes.
Yeah, this is again for the same reason because they are continuously, itching, and that's making
Itching,
them.
yes, yes, yes,
Mhm. Okay,
definitely.
doctor,
Yeah.
is there any dietary precautions or any do's and don'ts for the patients of urticaria?
Yes, so there are certain do's and don'ts that need to be followed for a case of urticaria. So, as far as dietary precautions are concerned, he or she has to avoid certain food items like eggs, nuts, then shellfish, food additive substances, then artificial food dyes. And if his or her urticaria is precipitated because of the cold, then he has to avoid as far as possible the cooler temperatures, like for example, air conditioning, etc. So these are also a fewer causes which can lead to urticaria. So as far as food items, the preservative containing foods, these should be avoided, eggs and shellfish, etc., because these are associated with urticarial lesions.
Right. So it's important to again, see what you're eating or what is
Yes,
actually the
yes,
triggering point of
triggering
your
factor.
urticaria, and you need to
Yes,
avoid that,
yes.
right? Okay. And doctor, is urticaria contagious?
Urticaria, not it's not contagious. Usually, it is limited to the person suffering only because it is individually, mediated because of certain triggers, and it's not contagious. Yes, the infections that might cause urticaria is contagious, but it does not mean that if the patient have this infection which has transmitted to another person, he or she will also develop urticaria. So it is no, it's not at all contagious urticaria.
Okay.
Yeah,
I'll also take some of the questions that our
yeah, sure,
viewers have asked. So,
sure.
Kiara is here, and Kiara's question is: can I continue with my normal activities such as sports or swimming if I have urticaria?
Yes, the thing to be seen in such cases is that if you are, suppose you are having urticaria because of the cold, and if you are involved in some kind of water sport or contact with cold water, then that might need to be avoided. In that particular situation where one might be having physical urticaria because of the cold, which is referred to as cold urticaria. Other
Mhm.
than that, the normal activities, yes, definitely patient can carry out once he or she starts with the treatment as advised by the dermatologist. So uh, that is the main aim actually, to make the patient go about his normal day-to-day life activities in an usual manner. So that is the main underlying uh, principle of treating urticaria. Yes, but the physical urticarias that might need some attention. For example, the cold and cholinergic urticaria if someone is having, for example, with excessive sweating, if he or she is going to the gym and because of the exercise is having sweating, then that can trigger the urticaria. So these triggering factors have to be avoided. Other than that, the normal activities they can carry out.
Fair enough.
Yeah,
So we were talking about over-the-counter medication and how
yeah,
harmful they could be, and Millie
yeah,
Agrawal has the same question, similar
yeah,
question. Are there
yeah.
any over-the-counter medications or creams I can use to relieve these symptoms?
Over the counter, actually, these are not recommended as we already discussed. But if someone is really having some difficulty, finding any dermatologist near them, then for immediate relief or some first line measure, they can go for lactocalamine application, that is calamine lotion application, which is a soothing agent basically, but that need to
Mhm.
be combined with systemic drugs nonetheless. But for starting the treatment for that purpose, they can definitely go for the lactocalamine application, which will calm the skin and provide certain degree of relief in the
Right.
initial phases. Yeah,
And as you mentioned about lactocalamine and how it
yeah,
calms down the skin,
yeah,
can people have so much of faith in home remedies? So in case they have urticaria, they'll put some aloe vera gel or something to
yes,
soothe
yes, yes,
down,
yes,
or
yes,
cold compression, etc.
yes,
Is
yes.
it a good idea to do it?
Yes, cold compression they can do. Definitely, there is no harm in doing cold compressions. And aloe vera gel and calamine lotion, these are definitely safe. But what must not be done is, certain local treatment, certain herbs and all, which
Hmm.
some different line of treatment practiced by many nowadays. So patient has to safeguard themselves from those kind of treatment, because we never know what are the side effects of those drugs. So they can harm the liver adversely, because most of the times we also get patients with drug reactions after getting treatment from unknown sources for certain conditions.
True.
So that has to be seen. And other than that, these home remedies like cold compression, then lactocalamine application, aloe vera gel, these are definitely, this can be done by the patient. But again, if not combined with systemic treatment, the relief that patient might get will be not very much. Initially, he or she might get relief, but again, definitely he'll have the lesions.
Right. So if you want to have, permanent relief or
Yes,
relief for a longer time or get it treated, you need to go and consult a doctor. For immediate
yes,
relief, you can apply some cold
yes,
compression or
yeah, yeah,
calamine or aloe vera,
yes,
but ultimately you'll
uh,
have to go and consult a
yes,
dermatologist. And
definitely.
don't fall for quacks or influencers
Never.
online, because
Yes,
you
yes,
never know, what's the triggering
mhm,
factor, and maybe
yes,
what you
yes,
are applying is the one that is your triggering factor, and it will
yes,
actually make the condition even worse. So please go and
yes,
consult the right person at the
yes,
very first place, and you'll end
yes,
up saving your energy, your money, your time, your health. So please go and
yes,
consult the right person.
yes.
Now we have Shilpi Yadav with us. Her question is,
Okay.
should I be concerned about potential allergies or sensitivities that may be triggering my urticarial symptoms?
Yes, food allergies, then as far as these urticaria is concerned, dust allergies, these are very important causes that can trigger. And also sometimes application of certain cosmetics or any kind of some creams, sometimes this can
Mhm.
lead to the articular lesions if the skin is sensitive, and it contains some kind of additives, preservatives, which might again irritate the skin. So yes, the patient should be on the lookout for these allergies that might come in from the dust allergy or the food allergy, or for that matter the cosmetics that can cause these lesions. So patient have to be very careful before choosing their product while for day-to-day use. So yes, there can be lesions because of that.
Right. And we have also seen, especially after COVID, that those who were COVID positive were also
Yes,
suffering from hives, right?
yes, yes, yes.
So, yeah, what was the reason, doctor?
Yes, COVID is another infection, like as I said, upper respiratory tract infections, then pharyngitis, GI infections. So it is another viral infection which is caused by the COVID-19 virus. So, like any other infection can trigger urticaria. COVID also, we saw a lot of cases presenting with urticaria. So, once the treatment was performed for the underlying COVID-19, the lesions of urticaria also subsided. So, it was and just another association like with any other infection, which can trigger acute urticaria. Infections are the major cause of acute urticaria.
Right. Now we have seen a lot of children having urticaria, especially
Yes,
after, having fever or infection
yes,
something.
yes,
So how
definitely.
common is urticaria in children and how to treat it? What to do?
Yes, urticaria in children again it is very much common. Okay, very much common. We get a lot of patients, and how to treat is again same. If the patient is having some uh, precedent infection, on taking the history, if the mother gives history, the child has some fever with rash, then we have to treat the underlying cause. We have to treat the fever. We have to go for the treatment of the urticaria as well as together with the underlying infection. So again, we start with antihistamines, which are safer for the children. And if the patient has a very extensive lesion, then after treating the infection, we can also go for certain drugs, as I said, like corticosteroids to tread over the acute phase. In a short duration, you can go for the steroids to control the lesions, then again maintain on antihistamines. So the management is similar, and the underlying cause, which is very much common in children, is infection that needs to be treated.
Right. And doctor, as we are talking about, urticaria, and many a times it is due to food allergies as well. Now,
Yes,
because again,
yes,
people are so aware these days, so informed
yes,
these days, and we all know that we have these allergy tests,
yes,
right? They are
yes.
expensive, but many a times people won't even consult with their doctor. They'll go straight to the lab and get their, allergy test done, and then they'll turn up to the doctor with the reports that, see, I'm allergic to 50 food items. Now, practically, it
Yeah,
is not possible to
not
omit those
possible.
50
Yeah,
things from
yeah,
your food.
yeah, yes,
So,
yes.
what's your say on these tests? And can we get it done on our own, or is this going to be of any benefit, or we need to go through the channel of the doctor only?
Yes, yes. See, per se, it is not recommended to go for it directly because it's not like everyone will have urticaria because of the food allergies. It is
Mhm.
only a certain subset that has the urticaria. If patient himself or herself thinks that I'm having urticaria because of the food, then more often than not, there must be some other triggering factor as well associated with that. But patient, as you said, they directly go for the food testing and all allergy testing, so not very much recommended to go for it directly. We advise it in certain conditions after ruling out all other possible causes. Then only we go for the possible allergen from the food to detect any possible. We go for the food allergy test, or in some cases like the autologous serum skin test. These are specialized tests for the specialized classes of patients where other causes have been ruled out previously. So it is not much of use if it is done directly. But yes, if the patient is advised by his or her dermatologist, then definitely this has to be done. And food elimination can be an important factor after ruling out all the other causes of urticaria. So, not advised to go for it directly.
Right. And doctor, before we sum up the whole session,
Yeah.
any take-home message for our viewers?
Yes. So, take-home message is it is a very common condition. Most of the times, we get patients who are very anxious as to what he or she has developed. So, first thing is reassurance that it is very much common, and it can be treated. And also, the patient has to be reassured that you have to take your medicines as advised by the doctor. Because if
Right.
stop them abruptly, then you can have these lesions again and again. But the thing is, this is very much common condition, so you have to remain free of the allergies or remain free of the triggers. Like if someone is having urticaria because of the dust, then they have to be, you know, they have to protect themselves from the dust. If they are having solar urticaria, then they have to remain in the shade as far as possible. So these are the certain precautions that they need to take along with the medications prescribed. So if they can combine these two, then definitely patients will come out lesion free and relief for a longer time.
Right. Thank you so very much, Dr. Amlan, for your
Yeah.
valuable time. It has been a very informative session for our viewers, and
Yeah.
I'm sure they'll
Yeah.
use this information to prevent themselves and their near and dear ones from getting urticaria. And in
Yeah.
case they get to see such symptoms, at least now they know what to do. They know
Yes.
that self medication is going to be more dangerous, so it's
Dangerous.
better to
Yes.
approach a nearby qualified
Yes.
dermatologist. It was great
Definitely.
to hear from you. Thank you so
Yes.
very
Yeah.
much.
Welcome. Welcome. And the pleasure is all mine. And thank you to the team All About Skin Wellbeing for giving me an opportunity to connect with the viewers. Thank you, everyone. Good night.
Thank you, doctor. And viewers, thank you for your active participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day. Goodbye.